I think more and more we appreciate this concept of scanxiety, a term that acknowledges that patients can and often do have a lot of anxiety caused by going into a scan that is going to give some big news that may be good, it may be not so good. And certainly some patients get very worked up about that. Tell us, how have you felt going into scans? Does it lead to sleepless nights and a lot of concern? Or are you zen about it? What are your thoughts about this concept of anxiety related to a scan?
Well, I've gotten better with it over time, but no, I lose sleep the night before. I'm a Christian, and I do a lot of praying the night before. I do a lot of praying before, during, before you come into the office to tell me the results. Okay. But I'm more at peace with it now than I used to be. I think because you have me do it on such a regular basis, I figure if anything is going to show, it's not going to be anything major in that time frame. Mm-hmm. I think that helps.
My sense also is that you've gained some experience with it. You've had a lot of favorable scans under your belt, yeah. And one thing that I try to convey with patients who I think are have done well for a long time is that the longer you do well, the longer you're likely to continue to do well. That if your cancer has gone without any significant progression for many months or a year or longer, it's likely that the worst thing we're going to see is some pretty modest progression rather than a remarkable change, especially if you're feeling okay. Yep. Any particular recommendations, tips for others, or is it just something that you just have to have the experience?
Experience is a lot of it. I think you have to have a good support system, family and friends. I mean, my husband is my rock, and I don't know what I'd do without him, and he's always there for me, and it's just faith in your doctor. Mm-hmm. And
so I think certainly patients are going to have different approaches to this, and some will find prayer helpful, some don't. There's all different ways. Some people just do or don't get much anxiety, but I think it's really important to go in trying to convey that there's going to be a plan no matter what the answer is. So there's nothing that will leave us completely without anything to do. Even if it is focusing primarily or exclusively on comfort, but just to know the options and say it can either be very good and we'll want to keep going, it might show slight progression and maybe we'll change the dose of this or that, or maybe we'll do the scan more frequently, or if it shows clear change, we'll want to switch to something else, and here's what it is. So I think my perspective is that just trying to convey to patients that there's a finite number of options, and we will have a way to deal with any of these. It will either be reassuring or it will be a timely change that we need to move forward with. We don't want patients to continue on a treatment that is just causing side effects and not leading to an improvement in the cancer. Mm-hmm. So that's certainly what I try to do for my patients. I think it's also important to convey that this is your honest, best approach, that I'm going to share everything I know or think is going to happen with the patient, because I think that when there are ambiguous findings on a scan, it's really helpful to be working with an oncologist who can give you their experience-based best judgment and put it in some kind of context. I hope, and I think in most cases, it is really helpful for patients to hear, yes, this says progression, but I've looked at it. This is really not enough to change anything about, and I would consider it much closer to stable disease, for instance. Or to say, given that you're having more symptoms and there's progression now, I would favor this. I think it's important to know that, of course, the patient is the primary decision maker. I can offer recommendations, but no one goes to get treated kicking and screaming. And so it's just a a decision that ideally we're going to make together. But I want to be able to bring to the table my experience and most honest answer. And I think that by not just being a cheerleader, but being honest about what's realistic to expect and what's good and what's bad, I really want my patients to know that if I say something encouraging or good, I really mean it.
Yeah.
It's not just because I'm going to always be positive unfailingly, even in the face of something that shouldn't have that positivity. So.
You've got to have ultimate trust in your doctor, and which I have in you.
That's kind. Thank you.